everyone, congratulations on your new baby. My name's Elise, and is it okay if I do a head-to-toe assessment on your baby to make sure everything's okay?
Yes.
All right. So I'm going to unwrap him, and I'm just doing a general survey. I'm checking his position. Is he quiet alert state, active alert state? Is he sleeping? Is he crying? I'm doing a general inspection of his skin. I don't want to see a gray or a blue baby or any cyanosis, although blue hands and feet are common in the first few days. That is called acrocyanosis. There may be some bruising on the presenting part, stork bites. There may be a newborn rash called erythema toxicum. All those things are normal and will resolve on their own. So the first thing I want to do before this baby starts crying is to check their apical pulse. So I'm going to landmark to the fourth intercostal space, just lateral to the midclavicular line. And I forgot my stethoscope at work, but I'm going to be listening for a full 60 seconds, paying attention to any murmurs. The heart rate should be between 110 and 160 beats per minute. Next, I'm going to listen on baby sides for the respiratory sounds. I don't want to hear any coarse crackles or any wheezing, but the respiratory rate should be between 30 to 60 breaths per minute. I'm going to auscultate counterclockwise in all four quadrants to make sure bowel sounds are present. And after I've done this, I can go ahead and start with my head to toe. So the first thing I'm going to do is to palpate baby's skull. There may be overriding sutures, that's normal, but I want to make sure they're well aligned. There may also be some molding of the skull at this time. I'm going to palpate the anterior and posterior fontanelles, which should be flat, not bulging or sunken in. I'm checking for symmetry of the face. So baby has two symmetrical eyes. I'm shielding his eyes from the light to try to coax him to open them. So I'm looking that his eyelids do open. There's no discharge. If he'll allow me to, I can check his pupils with my pen light to see that they're equally round and reactive to light. If I draw a line from the corner of the eye to the top of the ear, they are in line, which is a good thing. I wouldn't want to see low set ears, which could indicate a congenital anomaly. Babies are obligate nose breathers, so I have to occlude the nostrils one at a time to make sure baby can still breathe. Some stuffiness is normal, but I don't want to see any nasal flaring. I'm going to insert a gloved finger into baby's mouth, and he should be sucking on my finger, which is reassuring to me that his sucking reflex is intact. I can see that he doesn't have a cleft lip. I'm checking his hard and soft palate and noting any cleft. I can also pull down on his bottom lip and check for a tight frenulum or a tongue tie. Then I'm checking the neck for any webbing or loose skin, carefully palpating the clavicles to make sure they're smooth and there's no fractures. I'm looking at all the limbs, making sure the arms are the same length, legs are the same length, range of motion is normal, there's no clicking or popping sounds. There are 5 fingers, 5 toes, and I'm spreading them apart to make sure there's no webbing, checking the creases on the palm to see that there are multiple creases and not just one single horizontal crease. I'm checking the rib cage to see that it's round and almost barrel-shaped. It's rising symmetrically with respirations. The abdomen is rounded, but it's not hard or distended. And when I palpate in each of the quadrants, I don't feel any masses. The appearance of the umbilicus really depends on the age of the baby, but it should be starting to dry up. I should see 2 arteries and 1 vein. I don't want to see any bleeding, herniation, swelling, discharge, anything like that. And I'm going to teach parents to keep the diaper below the line of the umbilicus. So moving on to the diaper area, I'm going to open the diaper. If this were a little girl, I would see that the labia minora and majora were clearly differentiated. Clitoris is covered. There might be some vernix in the vaginal folds. That's totally normal. We don't want to remove it. There may even be some bleeding, also normal. That's called pseudo-menstruation, and it's just a withdrawal from mom's hormones. If this were a little boy, I would check that the Urinary meatus was at the tip of the penis, not at the top or the bottom. And I would want to feel the testes to make sure they're descended, and they're about the size of little marbles. Then I'm going to turn the baby over and inspect from neck to anus. The spine should be straight, easily flexed, not curved. I'm checking the sacral area for a dimple or tuft of hair. If there is a dimple, I want to make sure that it's closed and I can easily see the base. I'm going to spread open baby's bum and check that there's an anus, it's patent, the anal wink reflex is present. And at this point I would ask the parents about any pees or poos. Have you had any concern with your baby's pees or poos?
It was a rusty color. It's pee.
Okay, so at this stage, that is completely normal. Baby's intake is minimal at this time, so the uric acid crystals are very visible. That should dissipate over the next few days. And in the first 24 to 48 hours, we're looking for meconium to be passed, which is the dark tarry stool, which will transition to milk stools, which are looser and yellow in color.